with us. I'm sorry for my bad English. If you don't understand, Rino can help me. Okay? So if you during my presentation you don't understand me, block me and I will repeat. It's important that I will be able to transfer to you all the concept of the new concept that is inside of this machine. So I start with my personal presentation. My name is Bond, James Bond. It's not true. I'm a dermatologist and I work in the University of Varese. And since 2002, I started to collaborate with the Research and Development Department to create some new technology. One of these was Smart Lipo. I don't know if you listen about this. That is a machine for the body remodeling, but it's an non-invasive technology because you must introduce inside of the body optical fiber. And also I start and participate in another company of the group, Quanta System. I participate in the research and development of Quanta System, and 5 years ago, we introduced inside of the market the picosecond technology that Rino well know, okay? Okay, so go ahead to the topics of today. You have actually different methods to reshape the body of your patient, and probably, I'm sure of that, surgery is the best. Unfortunately, there is some advantages and some disadvantages. It's very, very effective, but it's very invasive, the surgery. The liposuction works very well, but not all the patients are disposable to do a liposuction. So the high motivation of the patient probably is the most important disadvantage of the liposuction. After that, we have this technology, cryolipolysis. In my opinion, I try and I work with this system. It works very, very, very well. But unfortunately, only on the fat compartment. You cannot have any result, any improvement when you want to remove the remodeling of the cellulitis or the laxity of the skin of your patient. So great system for the fat reduction, not so great for the laxity and for cellulitis. After that, we have the transdermal laser. Works, I don't know. In my opinion, yes, I don't have great experience. I start to use this system. Works on the fat, but what I can tell you that all my patients report painful sensation. And this is probably the most important disadvantage of this technology. HIFU. With HIFU, I don't have great experience for the fat remodeling, for the fat reduction. Great experience for the collagen regrow. But for the body remodeling, I don't have great experience. My patient report that is painful, and I don't know, I repeat if it's so efficacy. Radio frequency. Every one of you know radio frequency because probably it's the most diffuse equipment in our clinics. Sure, radiofrequency works and works well in the laxity of the skin. You can treat different parts of the body with different system. You know that there are inside of the market monopolar, bipolar, tripolar, unipolar, and working with different radiofrequency system, you can cover all the body area. I don't know, honestly, if radiofrequency is so efficacy in the fat compartment. Sometimes appear works, at the time you cannot have any results. Also, if you work with very complicated technology, monopolar, tripolar, bipolar technology, sometimes the results in the body reshaping the fat compartment is not so great. So for this reason, they can decide to invest a lot of time and money to create a new technology able to be used for the fat remodeling, for the fat reduction, for the cellulitis, and this is an incredible story that I will show you, and for the tightening of the connective tissue. So the same machine with different secting, with different pieces for 3 different areas of the body remodeling. But before I start with the equipment, with the technology, I want to spend with you just a few words to set up, to focus on our target, which is our important target, the fat. And the approach respect this tissue is completely changed in the past 5 years. When I studied 20 years ago, we spoke about layer, fat layer. Now we are speaking about organ, totally changed. It's not only a tissue, but could be considered an organ able to produce hormone, to produce growth factor. Someone speak about stem cells inside of the fat. So the critical approach respect this tissue completely changed in the 5 years. This is the adipocyte. This is the unilocular cells that represent the basis of the fat cell. It's fantastic cells with a peripheral nucleus with a big cytoplasma, very big cytoplasma, that is represented with a big lipid vacuole and another small part all around the nucleus that contain a lot of different protein and other factors that could be considered the secernal products of the adipocytes. The large part of these cells of the adipocyte is represented by triglycerides, by an oil, and this is a target of our system. One of the capability of these cells is to grow during their life, and sometimes for genetic obesity expression or for obesity induced by high-fat diet, the adipocyte can grow 6-7 times more respect the normal size. And this is an incredible story because the hypertrophy condition of the adipocyte can modulate the endocrine production of the cells and can reduce the adiponectin secretion and can increase the leptin secretion, that are the 2 conditions for the hypertrophic condition of the adipocytes. Okay, this is all the relationship that the fat has with the other different organ in our body. So it's a very complicated organ. It's not only a tissue. So these are some of the growth factor, are some of the proteins that the fat can produce, and this production can influence the insulin sensitivity of the fat. It can induce the hypertrophic of hyperplastic degeneration of the adipocytes. Hypertrophic and hyperplastic condition are completely different. You know that the hypertrophic is related with the dimension of the adipocyte. The hyperplastic condition is related with the number of adipocytes. 2 different conditions that can create obesity in our patient. Okay, till now it's clear. In 2005, this, for me, genius, Professor Cintis, described a particular condition, pathological condition or paraphysiological condition of the fat layer in collaboration with Mitchell and Greenberg. He described the collection of macrophage around the adipocytes And this collection usually is related with the hypertrophic condition of the adipocyte and is associated with the adipocyte death. So during life, there is some condition that induce the death of the adipocyte, and these adipocytes are completely covered by macrophage. These macrophage that are located around the adipocyte, the death adipocyte, are activated macrophage, MAC2. So they are in phagocytosis state. So they are eating the tissue, the fat tissue, and this particular type of macrophage usually infiltrate the fat of the obese animals and human. Okay. Histologically speaking, morphological/histologically speaking, the macrophage has a particular distribution, and this figure is named crow-like structure. So you can find isolate macrophage inside of the fat tissue. But when you find this particular structure, I will show you here, this is the crown-like structure. When you find this particular condition, this particular morphological and histological figures inside of the fat tissue around the adipocyte, this means that macrophage are eating the adipocyte, that is the base cells of the fat tissue. Okay, and a lot of studies demonstrate that that adipocyte is completely it's completely die is correct, dead. So with an immunohistochemical study with anti-perilipin, perilipin is a vitality marker of the adipocyte, we demonstrate that this cell is dead. Okay. Interesting is this story that with a particular study on a know-how mouse model for hormone sensitive lipase enzyme, we demonstrate that this particular macrophage collection is present not in all the obese subjects, but is present in the obese with an hypertrophic condition. So you can have a lot of adipocyte, but if you don't have this particular hypertrophic condition, you cannot have this aggression from the macrophage. So this is normal fat cells, this is an hypertrophic cells, this is an hyperplasia of the fat tissue, and only if you have all hypertrophic condition or a combination of the two, you can activate this particular phagocytosis from the macrophages. So, I don't want to bore you, but remember that in normal physiological condition, this status is present in the around 10% of the fat tissue. This means that physiologically we have a turnover macrophage arrive, sniff the condition. If they recognize the hypertrophic status of the adipocyte, start to eat him. So, and the death of the adipocyte is particular because it's not a necrosis, it's not a apoptosis, because we can find the morphological condition of the necrosis, but around the adipocyte we cannot find the neutrophilic cells. So this is very strange because it's a death without inflammatory condition. So Professor Cinti and other researchers spoke about parapoptosis or necrosis like programmed cells death. what this means, that we don't have great inflammatory reaction during the digestion of the adipocytes. Okay, which was the challenge? We have normal fat or hyperplasia of the fat layer, induce artificially the hypertrophic condition, temporarily hypertrophic condition, to promote the phagocytosis, like a Pac-Man, and to reduce the fat layer. This was the challenge of DECA. Probably you have already seen this movie. You had this movie, this new movie, Jim. You had this new movie. This is fantastic.
You have this movie? Oh, you have.
You have. So you're very. So this is the microwave emission.
This one I see.
Yes, you have two different pieces, but during my presentation I will explain why we have two different pieces, blah, 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 blah. But you can treat different anatomical area. Actually, we are investigating for other anatomical district like face, but this is another story. You can select different programs for cellulitis, from laxity, and for fat reduction, and this is what's happened when you deliver the microwave inside of the body. You are able to promote a growing of the fat cells, and we are able to induce a parapoptosis of the fat cell with the digestion of the macrophage. So till now I told you an incredible story, marketing story, but it's true. I will try to convince you that I'm telling you the absolutely true. So why we decide to use the microwave, this particular microwave energy named Coolwaves, for a lot of reasons. The first one, if you consider the electromagnetical spectra, you can see that the microwave is exactly in the middle between laser emission and radio frequency emission. So you are working with a high frequency, not so high like laser, but a high frequency from 1 gigahertz to 100 gigahertz. This is exactly the frequency range of the electromagnetical emission of the microwave. And this particular emission is able to promote a molecular rotation and torsion of the dipoles, the molecular that are present inside of the tissue. This movement, this fast movement, is able to generate heat. So microwave is able to promote production of heat and to increase the temperature inside of the matters, inside of the tissue. But as for laser, that Jimmy knows very well, we have different penetration for different condition of the tissue. And the most important rule that are able to modify and to influence the penetration of the microwave, also radio frequencies, but the microwave inside of the tissue, is the conductivity and the permittivity. It's very complicated, probably for me, more complicated respect the laser, where we have wavelength, pulse duration, and different target. Here, the different permittivity and the different conductivity of the different layer induce different penetration, different depth penetration of the different frequency of the emission in the spectrum. So microwave radio frequency, in according with the particular frequency, will have different penetration and different depth effect. Is clear? Okay. If you want, I can explain you in the particular all the physics, but it's very, very complicated. Believe me, different permittivity and different conductivity of the epidermis, connective tissue, fat, give you the possibility to use different frequency of radio frequency and microwave emission to promote great penetration.
Does that mean if we are using less frequency, less than microwave, like say with the radio frequency 100 megahertz, and if you have a system changing the frequency from low to high, does that mean I can target the epidermis and dermis?
You can target...
like this movement?
Yes. You can target epidermis and papilla dermis probably, because when you work with radio frequency, you are working with a very high ratio between conductivity. So if you consider this is the microwave value of conductivity, and this is the value respect competitor, equipment competitor inside of the market that are working with radio frequency. If you pay me, I put the name of the competitor. But this is the different interaction with radio frequency and microwave. Every time you work with high value of conductivity, you cannot have great penetration. So for all the systems present in the market that are working with the radio frequency, you have less or more 70% of absorption in the epidermis and connective tissue. For this reason, radio frequency works very well in the tightening on the skin, because the 70-80% of the energy that you deliver is well absorbed from the connective tissue in the upper part of the skin, and only 30-20% is able to arrive in the subcutaneous fat layer. Why? Because the dielectric constant, permittivity and conductivity of the fat and of the connective tissue are different for radio frequency and microwave. Microwave has the possibility to penetrate more and deeper respect radio frequency. So when you work with microwave, if you respect determinate parameters, you can consider the epidermis layer like invisible. This is an incredible story. You can believe or not believe, but this is the graphic elaborate from our research and development department, where I demonstrate that when we work with microwave with 2.45 gigahertz of frequency, we are able to deliver more than 90%, 94, 93, well, I don't know, 94, they wrote 94% of the energy deep in the fat layer, and only 6% in the upper part of the skin, epidermis and papillodermis layer. So all the energy is delivered inside of the subcutaneous fat, so 94 and 6%. This is probably the most important comparison between microwave and radio frequency. 6% respect 70% in the upper part of the skin, 94% respect 30% in the deep subcutaneous fat layer. And you can understand that if you have more than 90% of the energy delivered inside of the subcutaneous fat, you can use less energy to achieve the same biological results in the deep fat layer. And working with less quantity of energy, of fluence in the epidermis layers means reduce any risk of side effect, and which is the most important side effect that we have when we work with high quantity of energy of radiofrequency, burning effect. So working with the microwave, you can deliver a high amount of energy in the deep subcutaneous fat with very low interaction with the surface of the skin. We have calculated that you can arrive 4-5 centimeter deep in the subcutaneous layer. Okay, you anticipate this slide. So the mathematics and the engineer inside of DECA decide to do some simulation. They calculate all the conductivity, permittivity of the different layer, and they create a mathematical simulation. So you can see that in this mathematical simulation, in 3 minutes you are able to induce a necrotic damage 4 millimeter in the deep in the skin, but the surface is completely maintained safe. From this part you can propagate the thermal damage deep 2, 3, 4, 5 centimeter with an internal thermal probe. This is not a mathematical simulation, this is the true story. We introduce a probe 1 centimeter deep in the subcutaneous fat layer, and we observe an increase of the temperature. See, 3 minutes after, you can arrive at 50, 52, 53 degrees. That is a temperature necessary and sufficient, to induce the hypertrophic degeneration of the adipocytes. Till here is totally clear, because this is now I introduce another amazing concept. Because you know that when you work with radiofrequency to promote great penetration of the radiofrequency, you work in monopolar, unipolar. What means that the radiofrequency can go inside of the body, and sometimes you don't know exactly where he is going. When you work with microwave system, you know exactly where the microwave are, because you have this particular effect that we call it fountain effect. All the energy delivered came back to the end pieces, so you don't have any dispersion inside of the body, as usually you have with unipolar or monopolar radiofrequency, where you close the circuits with the end pieces and a plate. In this case, everything is closed in 4-5 centimeters. And this effect, named fountain effect, is able to induce the molecular rotation and torsion of the subcutaneous fat layer, is able to increase the temperature to promote the histological damage that I will show you after. Naturally, this geometrical electromagnetical field, like a fountain, could be big or small to promote great or less penetration inside of the anatomical tissue. If I want works superficial, I will create a small fountain with a very small spray. If I want to penetrate deep, I will create a big fountain with a great central spray. So two different end pieces for two different biological effects of the microwave in different anatomical layers. Clear? Again, but till now I told you an incredible marketing story. Where are data, Professor Zerbinati? In God we believe, all other must bring scientific data. So now I start with the data, with the scientific data. Now I start to bore you with scientific data. We start with an investigative trial of animal. And the first point was do a ultrasound evaluation, because with an ultrasound you can magnify in vivo the thickness of the subcutaneous layer of the fat layer. So before and after 2 months, only one treatment. When I saw this image with my ultrasound, come on, 50% less of the thickness. It's incredible, 2.6 to 1.31. So we repeat in another animal the same experimental trial. Again, 3 centimeter to 1.4 centimeter. Again, 50% less. And all the evaluation demonstrate around 40-50% reduction of the subcutaneous thickness. We are not speaking about visceral fat. This is another story. All the fat that is above the muscle could not be treated. Okay, so if you check this data, you can see that after 2 months, you can have the around 50% reduction of the fat. Another important point to us was documented that all the story that I introduced you before about the safety of the microwave from the surface of the skin. I told you that if you work with this particular frequency, you can consider it invisible, the epidermis layer, was true. So with an histology before and after the treatment, we demonstrate the completely integrity of the epidermis layer. So if you work with this particular setting that I will show you after, you are not able to induce any burning on the surface of the skin, on the epidermis layer. So absolutely safely and echographically speaking, very, very efficacy. And now we decide to investigate the mechanism of action to valorize our hypothesis. You remember the hypothesis that I told you with my previous slide. So we decide to perform an morphological histological study of the fat before, immediately after, 6 months after the treatment, 6 hours after the treatment, 1 month and 2 months after the treatment, biopsy. In the fat layer treated with microwave. We start, this is the biopsy. Again, an ultrasound setting. This is the control, the normal fat you can see, the adipose side with the triglycerides inside, with the peripheral nucleus, exactly the image that I showed you in the third slide. Okay, and this is the transmissional electron microscope evaluation. There is lipids, there is the vacuoles of triglycerides. This is the membrane, the basal membrane of the adipocyte, and this is the interstitial space, the connective tissue that is around one adipocyte and another one. Okay, this is exactly what's happened 6 hours. Can I have some water? 6 hours after the irradiation with the microwave. T0 control, T2, 6 hours after. What you can observe in the right image. Rino, what can you say? Yes, some is reduced, but there is some where you can see the yellow arrow. You can see small bubble all around the big structure of the adipocyte. So our first question was, what is this? With this, with the osmium fixation staining, you can appreciate this small bubble all around the adipocyte, all the cytoplasmatic membrane of the adipocyte. So what is this? With ultra microscopical evaluation, we clarify what is this. This is the drops of triglycerides that coming from the internal space to external space with this blabbing. This is the internal lamina of the basal membrane. You are able to open, and this is exactly the extraflexion of the basal membrane from the interstitial space. So with this mechanism named blabbing, the adipocyte put outside of the cytoplasmatic space the small drops of lipids, of triglycerides. And this is the first signaling for the macrophage that start to arrive in the site. The interstitial space infiltrate by monocyte, the construction of the particular histological figures named crown-like structure, CLS, exactly the structure that I showed you before, are present in our fat tissue treated with microwave. And this is the crown-like structure of monocytes. They start to eat the small lipid drops, but during this phagocytosis, they hit also the adipocytes. And this is exactly what's happened. This is the adipocyte, this is the triglycerides, this is a macrophage. Inside of the macrophage, you can recognize all the small lipid drops, and during this digestion, this phagocytosis, is attaching and destroying the membrane of the adipocyte. I have a lot of histological image because we wanted to be sure about the mechanism of action. You can see the aggression, the digestion, the destruction of the adipocyte from the macrophage. But the question is, where macrophage go to the end of this phagocytosis process? And I show you now an amazing image. This is a lymphatic vessel, and inside of the lymphatic vessels, you can recognize the macrophage full of lipids. So you will eliminate the triglyceride through the lymphatic street. So with feces urines and urines, okay? So a physiological elimination of the triglycerides absorbed by phagocytosis of the macrophages. This is the story of ONDA, of the microwave system named ONDA. And 2 months after, this is for me is the most important image, because 2 months after the suspension of the microwave treatment, you don't see any alteration of the fat tissue. Yes, probably you can recognize smaller adipocytes, but there is not any signal of inflammatory process. When you stop to use the machine, 2 months after, you have physiological condition. If you introduce a probe, or also a cannula inside of the fat tissue, and you start to destroy, and do an histology 2 months after, you can see again a lot of inflammatory condition. And remember, the inflammation can induce an hypertrophic and a hyperplastic degeneration of the fat layer of the adipocytes. So this image that show you that 2 months after the treatment, there is a normal condition, a physiological condition of the adipocytes is very, very important for us. Okay. 2 months after, complete restoration of the ultrastructural adipocyte, and now there is the explication, our hypothesis. So probably when you work with microwave, the increase of the temperature is able to promote this degeneration, this dimensional degeneration of the adipocyte, that when arrived to the critical dead size, the maximum expansion, start to deliver some chemical signal that require in the sites the macrophage. Another hypothesis could be that the adipocytes during this degeneration activate some, again, chemio attractant for the macrophage that arrive from the monocytes that arrive, differentiate in macrophage and start to create the cloud diostratus. So this is the two hypotheses that we must again clarify. Is the collection of the macrophage depends to the directly production of chemio attractants or from the death of the fat cells of the adipocyte. During the treatment of the fat layer, we observe naturally also the collagen tissue, and we discover another incredible story. The collagen treated with the microwave show us the same birefringent condition. What is the birefringent? Birefringent is the birefringents show us and show you exactly the respect of the three-dimensional structure of the collagen. So this means that you are not cooking with the microwave, but you are solubilizing the collagen, respecting the three-dimensional structure. Before and after the treatment, the birefringent of the collagen was maintained. And we also evaluate with an immunohistochemical study that inside of the collagen was present collagen type 3 more than before the treatment. This is picrosirius red, that is a particular immunohistochemical coloration able to emphasize in orange and in yellow the new collagen production. So this means that working with microwave, you can have an interaction with the connective tissue, connective septa that is present between the fascia and the connective tissue that are exactly responsible of the cellulitis. Working with microwave, you are able to change the viscoelastical property of the septa. You are able to enlarge the septa, and so immediately after only one application, modifying the viscoelastical property of the connective septum, you can see an improvement of the cellulitis. You can believe or not believe, do the treatment. You select one patient with cellulitis, do a treatment, and you can see immediately the improvement. Someone told me, okay, come on, is an edema? Okay, observe the patient after 2 hours, 3 hours, 2 days, 3 days, 7 days, 10 days, and the patient maintained the improvement after the treatment for this particular mechanism of action directly on the connective septa. Okay. So I won't bore you, but I'm so proud that yesterday Ieri means yesterday. This newspaper communicate to us to accept our job. So in the next 2 weeks, dear Jim, you will have an article published in PubMed about this technology. But I received yesterday, 3 o'clock, 4 o'clock. And this is, for me, is very important because it's a peer-review journal recognize our job. Okay, clinically speaking, this is the protocol that we used for the treatment of our patient during the clinical trial to evaluate the methodology. We treat our patient, okay, treat in movement with aid of Vaseline. Why? Why Vaseline? Because if you put water, a gel water-based, you are creating a dipole and you will alterate the chemical structure of the surface. So all the microwave will be well absorbed from the water and you will burn the skin of your patient. So works with no water medium to promote the movement of the end pieces. So we worked with 2 different end pieces, for deep end pieces, the big one for the deep action for the fat reduction and the shallow one for the cellulitis. We delivered an estimated power of between 80 and 200 watt, but I will show you this is incredible because the machine setting for you the value, the power, the fluence, the time. You must introduce inside of the check panel control only some clinical data, and the machine automatically will select for you the best protocol. I trace an area of 15 per 15, and after that I spend not more than 15 minutes to treat an area of 50 per 50. This is an incredible story because in only 10-15 minutes you can treat an area of 15 per 15. If you consider that you don't have any disposable, consumable, you can understand that the treatment could be considered with a very high reactivity. So 1 treatment each 2 or 3 weeks for a maximum of 4 treatments. But sometimes, especially in cellulitis, after 2 treatments, the patient decides to stop for the so great improvement. Some clinical case. This is Stephen from Florence, before and after. You can see the different volume of the abdomen area after 4 sessions. Before and after. And then, again, abdomen area, you can see the different line of the love angle. Okay, abdomen, before and after. You can appreciate the different volume. 4 sessions. So 1 ml is not enough. Okay, this is what we can do with non-invasive machine. We are speaking about 4 treatments of 15 minutes without any pain sensation, is not painful, and without any risk. Okay, before and after. Here you can appreciate not only the reduction of the volume, but also the tightening of the skin of the patient in the periumbilicular area. 4 sessions. Again, Stephen from Florence. Again, laxity and volume of the internal leg and hips, trochanteric area. Again, internal and trochanteric line. Cellulitis improvement after 4 sessions. This is not the best. I will show you the best, but this is all case of friends of mine. This is Paolo Bonham. Probably some of you met Paolo because he's another KOL of DECA. Before and after. In this case, 3 sessions. Before and after 3 sessions. See the redefinition of the abdomen volume before and after. You can appreciate. Paolo decided to use also an objective instrument to evaluate the reduction in terms of volume of the abdomen fat, and he decided to use this instrument also to evaluate the reduction of the circumference, to demonstrate that after only 1 treatment, sometimes you have 10% of reduction in terms of circumference. At the end of the session, sometimes 20% of reduction in terms of circumference. So important value. Okay, I have also my clinical case, not only case from France. This is my male patient, before and after, see, 2 sessions. If the condition, the morphological condition of the patient is related with a lot of subcutaneous fat and not visceral fat, and with an hypertrophic condition of the fat, you will have amazing results in only 2 sessions. If the patient presents not so great quantity of fat in the subcutaneous layer, but all is located in the visceral area, probably you will not have great results. So if you have an ultrasound, do an ultrasound evaluation just to do a correct prognosis. Okay, before and after 4 sessions, female patient, you can see the new reshape of the hips area. Okay, I decided to promote a morphometric computerized evaluation of the area. Before, after, and I compare the 2 areas. This is the reduction in terms of volume, 20%. Again, another one, before, after, I compare, and this is the reduction, around 20%. I do this particular computerized evaluation for all my patients, and the average of reduction was around 20%. That for me was enough. In only 3-4 treatments, you can achieve these amazing results. Claire, if you introduce more sessions, probably you can have better results, but the patients are happy, and this is exactly what I evaluate in terms of ultrasound data. This is an average of the treatment of my patient. I take the best image before and 15 days after the end of the last treatment, 4 treatments. You can see the reduction of the subcutaneous layer of 1.85 to 0.87. So 50% of reduction of the subcutaneous fat layer. So in cellulitis, this is the incredible results that you can achieve before and after only 1 session. For the interaction of the microwave with the connective tissue of the septa. Okay, my time is finishing now. Okay.
Up to you.
No, you told me not too long, and so I. Also, in this case, we did this morphometric computerized evaluation to demonstrate the efficacy. And in conclusion, I can tell you that all the histological and clinical trial demonstrate the absolutely safety of the system. To burn the patient, you You must stay in the same position for 2-3 minutes. You won't create the side effect. If you want, probably you are able. But if you work with the correct protocol, it's quite hard or impossible to induce any side effect for the reason that I explained to you. The treatment was demonstrated very effective for fat reduction, and I show you, for the cellulitis, for the reason that I explained to you, for this directly interaction with the viscoelasticity of the fibrotic tissue of the septa, and for the solubilization of the collagen, you are able to move new collagen type 3. So you have an interaction also on the laxity of the skin, and the histological findings support the hypothesis that the outcomes of the treatments may long lasting. This is an important point. This is my clinic where I perform the clinical trial. This is my city, Pavia, and this is One Love, the new love. ONDA. I just want to show you two things about the machine. I turn on the microwave emission equipment, and in less than 1 minute you will be able to start the treatment. So the warm-up of the machine is very, very fast. This is important. You mustn't wait a long time. So system checking, 6-7 seconds, and now we are ready to start with the treatment. Okay, after that, the machine will ask you, you want to treat localized fat, you want to treat cellulitis, or you want to treat tightening of the skin. In case of, for example, cellulitis, the machine asks you, you are treating a male or female? So in case female. Okay, and now the machine asks you which anatomical area in this female patient you will treat. Upper part or down part? Down part. Which part of the down area of the body? For example, leg. Okay. And now the machine asks you which kind of clinical study is the cellulitis. Type 1, type 2, type 3, type 4, because in agree with the clinical condition of the cellulitis, the machine will select for you the right power, the right quantity of fluence. And in this case, you can see that 10 minutes of delivering energy. So 10 minutes. Now we came back. In this case, the patient asked us to treat the fat, localized fat. Again, the machine asks you. And now the machine are asking us how much fat is present in that area. With the plicometer, you will evaluate the fat compartment present in that area. In this case, is with 2 centimeter. You select 2 centimeter. If it's 3, you put 3. If it's 4, you put 4. Okay. And automatically, the machine select for you the right power in terms of watt, the right fluence, the right dose of energy, and the time that you will spend to delivery. And so in only 8 minutes, you will be able to cover your treatment. Now we are able to start. Okay, place ready. Take your end pieces. And we start. We are working. See, if I'm not in perfect contact with the skin, the machine immediately stops to work. And we will start to work only if you will couple it with the skin. This is a safety procedure to avoid the risk to delivery the microwave not in contact with the skin. This is all. It's very easy to learn and to perform. Please, doctor, come on.